This is Selma Schimmel in Chicago at the annual ASCO meeting for the group room, and discussions continue here. And we're joined now by Elizabeth Rodriguez, who's an oncology nurse and the nurse leader of ambulatory care services at Memorial Sloan-Kettering Cancer Center in New York City. Welcome.
Thank you.
We're going to talk about something really interesting with you, patient portals at oncology. How do you see the future of the way patients will access and exchange information, also interfacing with their physicians and healthcare providers?
Well, I think by providing them this information on portals and it's in an electronic format makes all of that so much more easier, really. Now patients, particularly oncology patients, they're followed by sometimes many different doctors. They have a primary care physician, they might have a cardiologist, so they're able to take that information electronically and then they can download it, they can print it at home, they can bring that information and share it with other providers, which is really helping to bridge and create some more continuity of care across the continuum.
Would you expand a little bit on the sorts of information you're speaking about?
Where I work at Sloan-Kettering, we started offering patients access to their lab results about 3 years ago. And in this past year, we're starting to display their CAT scan and MRI results on patient portals. So having access to that information specifically has already made quite a difference for patients. We've heard feedback from them.
If the patient then is seen at another center, the patient can take their medical records and health-related records and transfer that information? Or does the cancer center control it?
The patient controls it. They can't transfer it electronically right now to another center, but they can print out a paper copy and bring it to another provider.
We understand that there are distinct differences between electronic medical records, electronic health records, and patient health records. Do you want to comment on that at all? I mean, those are three and most people don't understand that there's a distinction.
The portal for us is really just a gateway of, or a place to exchange information, to get the patient's information for their electronic medical record. It goes through the portal to get to the patient. It's not a place to store information, which is much more like a patient health record, where patients actually upload and store information to that. That's not what the portal does.
What will the portal do to support that kind of information to help patients?
When patients are going on to view their results, we actually steer them towards a specific website called labtestsonline.org that we've vetted and we know that is going to provide them good information. So if they're having a question about what does it mean that my white blood cell count is this number, or if it's out of range, we provide a direct link to the white blood cell count information on that website.
If there was, and let's just say it's a diagnostic report that's really difficult and you know it's going to be challenging emotionally and mentally for patient and family, will the patient have access to that before they're notified or have a conversation with the doctor, or are there considerations there?
The potential exists for that to happen. With the radiology results, we release them 4 business days after they're available in the medical records, so there is a little bit of a delay for when the information is available to the patient. In most cases, the clinician will have viewed the result before it's gone to the portal, and so I think, particularly if you're anticipating that the result could be difficult, I think that we could mitigate that in most circumstances, but certainly the potential is out there that the physician or nurse may not read the report before the patient does.
That's probably the one area that you're still trying to analyze a little bit more.
Absolutely. It's an area that causes a great deal of concern and anxiety from the clinician point of view, and that's really what we're trying to balance. I don't think that we'll ever get to 100% satisfaction on both sides. Patients really want the information as quickly as possible.
It's their information, it's their body.
It is, and we've looked at, I believe down at MD Anderson, they actually built in a 2-week delay for the result information to go to their portal. And what they found is that there's not a lot of interest from the patient, and to see it 2 weeks later, then, it's become a lot less meaningful to the patient to get it 2 weeks later. They've already gotten it probably from their physician. So, we're really trying to look for just the right time.
This is probably going to be a model for the rest of the country as Other cancer centers are observing those who haven't adapted to portals yet are looking about how it's going with some of the major cancer centers, and this is probably going to become pretty much the standard.
I certainly hope so. I think that we're really trying to lead the way in trying to do the right thing for patients and also for the providers.
As we go more virtual, how do you deal with the issue of the lack of personalization?
I think that we really have to use technology to augment our personal interactions and just keep that sort of framework at the front of everything that we do. So to not ever really look at it as a way to replace personal interaction, but just as a way to make it more meaningful. So for instance, if patients have access to the portal and they're able to use email or secure messaging to communicate with me when they're not physically present at the hospital, then the times when they are physically present, perhaps that conversation is more meaningful because we've taken care of some of the simpler questions or prescription refill that needed to be done. Those things got taken care of electronically that we could. Now when you're here with me, we can really focus in on what needs to be done.
Do you have suggestions or advice for viewers and physicians that may be tuning into this?
Certainly I do. This is something that patients are asking for, unanimously, really. They really want this type of access, and I think what's been difficult is that physicians and nurses are sometimes reluctant to provide the information, especially if the information can be indicative of worsening disease or a new diagnosis. So there's a lot of thought to be considered around how do we present the information to patients, what's the timing around it, and what kind of support can we provide to patients who are accessing the information electronically, things that they may have used to have heard or seen while they're in the office with their physician or nurse. So it's really changing the whole dynamic of how we provide information to patients.
So now more than ever, I would think that providing patients with information to empower them is really important.
Mm-hmm. I couldn't agree with you more. I think that there's a lot of research that we could do in the future to actually see how that empowerment might actually affect the patient outcome for the better, I believe. So I think really it's just balancing all of that good things that we know about empowering patients and providing with information, while recognizing that we still have a culture within the healthcare community of being very paternalistic and sort of the keepers of information, and sort of just finding a way to balance both so that we do this in the right manner.
Thank you. Elizabeth Rodriguez, oncology nurse and nurse leader, ambulatory care services at Memorial Sloan-Kettering Cancer Center in New York City, helping to push technology in the hands of patients.
Thank you.
You're welcome.